Dr. Ravandi, can you define molecular testing for AML patients?
We have progressed on our understanding of cancer in general, and we have progressed in our technology. So we know that various cancers are likely caused by a number of molecular events, and this is best characterized in leukemias because we have been doing this in leukemias for many years now, simply because leukemias are much more accessible than other cancers. The leukemic cells are in blood and easily obtained, and even in bone marrow are much easier obtained than other solid tumor cancers. And so we've been able to identify a number of gene and chromosome changes that we have discovered to be prognostic, but also have become the targets for developing effective drugs.
Beyond molecular testing, what other testing should take place following an AML diagnosis?
I mean, it's the classical patient presents because there is something wrong in their blood count. So they usually have had a blood count testing done. And of course, you need to do a number of other tests. For example, the chemistry profile, because that can show us some of the problems that can be caused by leukemia. And the most important thing is a bone marrow aspiration and biopsy, which is still, unfortunately, absolutely necessary. First, to make the diagnosis, and second, to obtain the specimens for those biomarker testing that you mentioned.
If a patient relapses, does all of this testing need to be repeated?
Unfortunately, yes. And so when you said all of this testing, actually, again, compared to some other cancers, this is limited testing. Taking blood for the blood tests and even doing a bone marrow is generally much easier than taking tissue in a colonoscopy or a colon cancer, or doing a lung biopsy in lung cancer, etc. So, but yes, they all need to be tested, and actually, we do like to repeat the genetic testing because leukemias are dynamic, and after initial therapy, they may change in ways. They may develop new targets or new molecular changes that may be potentially amenable to new targeted therapies.
And is it common for a mutation to appear at a relapse?
It is, yes. I would say I wouldn't say it's common, but it is frequent.